Hey, I'm Leslie Austin with Burke Hospice and Palliative Care. I'm the clinical liaison here, and what I do is I go out and educate our community on the services we provide, which are actually 3 services: transitions, palliative care, and hospice. Our transitions program is a program, there is no payer source. It's a free program that we provide. We send a social worker in, and what that social worker does is they help that patient and family to navigate through services that they will need. Palliative care is basically symptom management. It is for those patients who are still seeking aggressive treatment. They have a chronic illness, not necessarily terminal like hospice, but a chronic illness, and we send a nurse practitioner or a medical director out to help manage these symptoms that they may be having at home, such as pain management. If they are seeking aggressive treatment such as chemo, we can help reduce the nausea, just help them feel better, provide those services in their home, not necessarily going out to the doctor's office to have that done. And we also send a social worker and a registered nurse who helps keep an eye on these patients. Through that program, we also do help with end-of-life planning, such as advanced directives, most orders, that kind of thing. And then hospice is our largest service. A lot of services are included there. We are the experts of end of life, and so we help with that part of life. Everybody is going to reach end of life. Not everybody deals with it the same, and not everybody plans ahead. We plan for everything in life, everything, but we don't stop and think, what do we want at the end? So just having all these connections, networking, I want to be that resource for the community to help them see that it's okay to plan end of life. This is a home. We want everybody to feel at home here. We want them to use it as they would like, and we want families to just come together. And this is our hospice house for Burke County, and we have 14 private suites. In these suites, we have things that you would see in a hospital setting, but we have them discreetly enclosed behind a cabinet so it does not take away from that home-like feel here. We want people to just roam the halls like they would do at home. We want them to treat this like their home. Families and friends are welcome here anytime, day or night. We do not have visiting hours. It's 24/7. We have registered nurses and CNAs. And we have Bee. She is our dog. The residents love her. She is here every day. And actually some of our residents in the community facilities, she is taken to see them too. So she is a part of Burke Hospice. This year we opened our Thrifts and Gift Shop in downtown Valdez. Now we did that because over the past 5 to 7 years we've provided over $2 million in free services. We're a nonprofit organization. We do not turn people away because they may not have a payer source. We still provide everybody the same type of services, so we needed a way to help offset some of that expense. So that is how we started the thrift store. And a lot of our patients, when they pass, the families donate their belongings, and it has been very, very successful. Our leadership here at Burke Hospice is awesome. Our staff is awesome. And our CEO, Ron LaSalle, he was voted best boss in Burke County this year, and consequently he is also a patient of ours, and this is just a fantastic organization, and I encourage anyone to come, take a tour of our facilities, get any information. There's somebody here all the time who can answer any questions there may be about any of the services we provide. Would absolutely recommend the Chamber to anyone. I'm a new member, just a few months, but what I'm hoping is I believe we will start the visiting other companies. So being an ambassador, you know, I want to be involved in everything that goes on.
What was it like being part of leadership, Burke? What are some of the things that you learned?
I loved it. I loved it. That is where I really started learning about our community. For 10 years I worked in our surrounding counties, and so it was good to be home and learn in depth our county. I have lived here all my life, but there are lots of things I don't know about Burke County. I do all of the eye-opener breakfasts. I do the after hours, and I have been asked to be on the committee for the planning of the upcoming Leadership Burke. I talk about the Chamber to everyone, not only business, but we just recently signed up a new member who is just an individual who is excited about being a part of the Chamber. And everyone I talk to, I encourage to be part of it.